Tiziana Bonzon is one of the authors of the report. She's also the manager for migration activities at the IFRC. Tiziana, welcome to the program. We began at the top of the hour with an update from what happened at Moria camp on the island of Lesvos. Do you mind if I just ask you about that? Because the EU has said, due to the fires that have displaced now, leaving 13,000 refugees homeless, the EU needs to reconsider its migration policies. What do you think the EU should be doing that it's not already been doing?
So thank you for inviting me. And allow me to say that, of course, what we are bringing to this conversation is very much a humanitarian perspective. And we've been, of course, talking to EU states and interlocutors for a number of years, trying to promote what we believe should be a humanitarian approach to this crisis. These people have been looking for safety for a number of reasons, and particularly those who have been welcomed and hosted in Greece on the Lesvos Island have been there for many, many years, some of them in unfortunately overcrowded and unsafe situations. So what we are asking is to come to solutions, more durable solutions for these people, ensuring that they can be provided with, first of all, for those who have been affected by the recent tragedy, provided with basic services, access to safe shelter, food, water, but of course also protection. I mean, we need to start looking at more durable solutions for these type of situations.
Okay, we wanted to bring you onto the program specifically to talk about this new report that your organization has released. Tell us more about the vulnerabilities that you have found facing refugees due to the coronavirus pandemic.
Allow me to say one thing. You know, this virus does not discriminate. Everybody can be affected. However, people are not affected people are affected in a discriminatory way. And indeed, migrants and refugees are part of those groups that have seen the vulnerability and situations of precariousness being exacerbated by the crisis. The crisis is indeed a health crisis for many of us, but it is also a socioeconomic crisis and a protection crisis. And this is particularly relevant and applicable to these groups of people who are facing a number of informal and formal barriers and obstacles in different contexts. This is what the report is highlighting.
There have been reports of COVID-19 being detected in a refugee camp in Jordan. We know that it already exists in Cox's Bazar in Bangladesh. A case in Idlib in northwestern Syria has raised concerns about refugee camps there. We already know that at least 30 people who had been living in Moria on Lesvos have tested positive for COVID-19. How are these camps going to cope? Social distancing very much appears to be a privilege of the rich.
You're right. As I said, this virus is not discriminating. It's not discriminating, and everybody can be affected, as I mentioned. And unfortunately, people are living in these very precarious and difficult situations are also extremely vulnerable. We are present in all of these contests through our Red Cross and Crescent national societies. We are working in Cox's Bazar with the Bangladesh Red Crescent. We are working in a number of camps for migrants, including, in Greece that we just talked, and through the work of the Hellenic Red Cross, for instance. What we are trying to do is to promote what are often very local solutions and practices. I know it may sound difficult to apply, but we are experiencing good examples where by engaging as well the migrants and the displaced people themselves to be part of the solutions, these practices can be applied. So I know physical distancing is not easy, but it can be applied, ensuring that people can be isolated when they are infected, identify specific spaces within the camps, ensuring that people can have access to appropriate information in a language and in a format that they can understand, increasing the number of water points so people can access water, sanitation facilities, and of course distributing hygiene kits. This is part of the response that we're trying to promote in this very difficult context.
When we started the conversation, we were talking about the European Union, and what especially countries like Greece and Italy say is that we, as the first point of arrival for many migrants and refugees, we need a more equitable distribution of these new arrivals. And for the past few months around the world, many nations have closed their borders because of COVID-19. What do you think is going to happen over the next few months, however long the pandemic lasts, in terms of countries keeping their borders closed, especially to migrants and refugees?
I wish I had a crystal ball to answer your question. In reality, what we know is that the closure of borders, while of course these are measures that have been taken to be able to contain the spread of the virus, what we are also saying is that people are already fleeing life-threatening situations should be allowed to seek safety. And despite the measures that we are putting in place, states should be continuing to ensure that people can access international protection, that those who are seeking asylum are not excluded from that. And this is possible to do with appropriate measures, ensuring maybe quarantines are respected before people actually access this type of services. It is possible, and we know, for instance, the Italian Red Cross has been collaborating with authorities to look after those who are arriving on their cost and providing appropriate services while people are being quarantined before they can actually disembark and access public services.
Tiziana, thank you so much for joining us on the News Hour. Tiziana Bonzon from the International Red Cross and Red Crescent.